This is a video discussing substance abuse in schizoaffective disorder or schizophrenia or bipolar disorders. In these chunks of the population, we see much higher rates of substance abuse. At I believe in both, it's 50%. So that's 1 out of 2 schizophrenics or bipolar patients, or any disorders in that area. 1 out of 2 will experience an addiction or alcoholism problem at some point in their life, be it to prescription meds or other drugs. Some of the most commonly abused meds we see, or drugs in this subgroup, are cannabis, probably the most commonly abused one, as it is in the regular population, next to prescription drugs. Now, cannabis it does alleviate some symptoms depending on the type of cannabis. Indica, for example, indica strains can be helpful to some people, but in the long run, there is a lot of scientific evidence to state that exposure to THC, as it is a psychoactive substance, is bad for people who have a psychotic disorder or thought disorder. It can increase paranoia, it can make delusions worse, it can bring on hallucinations, it can trigger the disorder in people that don't have the disorder, which is why a person has to be very careful. Other triggering drugs are psychedelics. These can bring on full psychotic episodes. It can make a person very delusional. Sometimes these last for months afterward when we see psychedelic use in these patients. The most commonly abused drugs other than that is, of course, alcohol. Alcohol is a depressant, which can make depressive episodes worse. Being drunk can make mania in bipolar patients, can make that worse. In schizophrenics, being drunk can make your reactions to your delusions and hallucinations a lot worse. It can cause people to black out a lot easier, lose control of your actions, as is with the regular population, pretty much, how alcohol affects people. Of course, there are several more than several people who are able to just have a drink or two and stop. For a while, I wasn't one of those people, but now I've learned enough alcohol-related lessons that unless it's an occasion and I'm planning on getting plastered, I can stop myself at a drink or two, which I'm pretty proud of. A lot of people can't do that. And that's when they need to learn that, they need to back away from the sauce. And then we see commonly abused uppers to mimic mania or to temporarily alleviate negative symptoms of schizophrenia, but these do make positive symptoms worse. So we're talking about amphetamines like meth or Adderall, 5-ANs, and we're talking about other stimulants such as Ritalin and cocaine, caffeine. These can trigger manic episodes. They can make them worse. They can trigger paranoid delusions. They can make them worse. They can make positive symptoms worse. Although we do see the self-medication mainly used to alleviate negative symptoms and to alleviate depressive symptoms, respectively. Another one is MDMA, or Molly as they call it. Other uppers are PCP. I think anybody should avoid PCP, crack cocaine, in addition to regular cocaine. I could name more, but now the most commonly abused prescription drug among this subgroup is benzodiazepines. Of course, a close second is opioids, but benzos are particularly dangerous because they are commonly prescribed for these two disorders off-label to treat certain symptoms. These can be easily turned into drugs of abuse, so we're talking about Klonopin, Valium, Ativan, Xanax, Atizolam. That's really all I can name off the top of my head. Oxazepam, temazepam, These are benzos, and they are research chemical benzos like clonazepam. No, clonazepam. I don't remember. No, I believe that's Klonopin. I don't remember what it's called. But there is a few research chemicals out there that are completely legal that mimic benzos. There are non-benzodiazepines such as Valium. Or no, not Valium, such as Ambien or Zolpidem, as it's called. These have common abuse rates because, like I said, they alleviate a lot of positive symptoms as opposed to alleviating negative symptoms. They can make depressive episodes worse, however, and they are highly, highly addictive. Physical dependence happens about 2 weeks to a month after you've been using them every day. Withdrawals are absolutely horrible, god-awful. It's important to know that if you want to get off of prescribed benzos, or even if you're trying to stop using them yourself, cold turkey could potentially kill you depending on how much and how long you've been using. It's like alcohol in that sense. These withdrawals can be so bad that they could kill you. So it's very important to taper down or to have some other kind of substance there. Trying to think. Oh yeah, so then we got opioids and opiates. Oxycodone, hydrocodone, codeine, morphine. Codeine and morphine are actually opiates, not opioids. Dilaudid, hydromorphone, tramadol. These are all opioids. They're commonly abused because they bring the person down, make the body tingly, make you feel lazy, and can alleviate negative or positive symptoms and can alleviate mania for brief periods of time. So that's why they're commonly abused. There are legal drugs out there that are abused, such as Phenibut and Kratom. These have varying effects depending on the dosage. They're weird. In small doses, both of them will work more as stimulants. Higher doses, they both act more like painkillers. And then we see drugs that can sometimes be abused is actually Seroquel, which is commonly prescribed to treat both of these. Now, it doesn't have much recreational value, but patients may stock up their meds and take them 2 or 3 at a time, and then go with their manic episode or their psychotic episode for a few days unmedicated, and then take 3 pills to sleep for a day. I know a few people who do this. This is not only abusing your prescription, this is just not a good way to treat yourself. You will see no progress. You will wake up just as delusional, just as paranoid, just as manic if you do it like this. That's just about guaranteed. So, trying to think of anything else we didn't cover. There are other drugs that are prescription only, not technically narcotics, that people will abuse. Muscle relaxers, promethazine, things like that, Lyrica, Soma. But these drugs aren't commonly abused, but they can be abused anyway, because they are downers, and most pillheads don't really care as long as they're taking something that could cause drowsiness or dizziness and something that shouldn't be taken with alcohol. A pill addict will eat what you give them. As messed up as that is. Other drugs of abuse to be careful about being prescribed even are gabapentin. This is potentially abused, taken in high doses mixed with other drugs. So one must be careful about using gabapentin as well. I believe we've covered most of what I wanted to talk about. Drugs, pretty much, though they may feel like they temporarily relieve symptoms, they can, and in the long run probably will, just make things worse and make recovery a little bit more difficult for that patient. Some people stand by that CBD helps them or that weed helps them, benzos help them. I'm not gonna argue. I'm just stating that people who abuse these drugs instead of taking them in a responsible manner are almost sure to see negative results in their treatment and in their recovery from symptoms of their disorder. So, cigarettes also. 90% of schizophrenic people smoke. 60 to 70% of bipolar people smoke. This is not illegal, obviously, but it is still, nicotine is a drug. It is technically a stimulant. Studies actually kind of show that it might be good for schizophrenia symptoms, which is very ironic because it's one of the most unhealthy things you can put in your body. And I myself am a smoker. I myself drink caffeine, but technically, if you want the best recovery, it's best to avoid these things. But no one's perfect, and we all have vices. Every single one of us has a vice, even if it's not a substance. That's about my 2 cents. If anyone has any experiences they'd like to share, or any issue with anything I said, maybe I said something wrong, feel free to correct me in the comments. You guys have a good day. Thank you for watching.